If you've been told that you have mitral valve regurgitation, you should go see a cardiologist. And the cardiologist will do a physical exam, and based on that physical exam and your history, can then decide whether you need an echocardiogram. A transthoracic echo is non-invasive. It's a 15 or 20-minute study, and it gives us a baseline to understand not only your mitral valve function, but also your ventricular function, how strong your pump is squeezing. If there's any concern at all, an echocardiogram is a very easy way to understand better whether it's something that's going to need to be focused on in the future.
Across the board now, it is well known that a repaired valve is associated with less risk during surgery than a valve prosthesis. Survival after mitral repair, there is no doubt, is better than mitral valve replacement, and the reason for that, you keep the natural tissue, you keep the blood supply, resistant to infection is better. You have less chances to have endocarditis on a repaired valve. Putting a prosthesis is a risk. If you have a metal valve, you're going to be at risk of thrombosis, risk of strokes. Still, we believe in the biological repair as a biological solution for the mitral valve disease.
Well, there's not much a patient can do to enhance the durability of a mitral valve repair. The first key thing to having a durable mitral valve repair is having a very good repair of the initial operation. You cannot break the mitral valve after it's fixed. You should not have to think of your mitral valve after it's repaired. You should have a normal life, not worry about any other factors. You should be able to just live your life without thinking about your valve.
During routine mitral valve surgery, the bypass machine has a negligible effect on the brain. The vast majority of patients will go through surgery with no noticeable effect whatsoever on the brain. There are, however, a very small minority of patients, usually below 2%, that can suffer a significant clinically relevant brain injury, for example, having a stroke after heart surgery, which thankfully is quite rare, but if it occurs, in most patients it is treatable and most patients will get reasonable recovery.
When we're looking at cardiac surgery, quality is difficult to define by everyone. And we have the best measures and data of any specialty in medicine, but it doesn't capture everything. So the difficulty is finding data that you can trust that really reflects what the whole program does. There's a correlation, it's not perfect, between volume and outcomes. So I would be looking at a high volume center, but that's not good enough to do a lot. You have to know that you do them well. So you would like to know the patient mortality or death rates with the procedures associated and other major complications like stroke. And again, hospitals don't operate, surgeons do. So you not only want a hospital that is good at this, but you want surgeons that are individually good at it.
I think patients that are told they need mitral valve surgery should get themselves educated. Particularly if it's elective, get a couple of opinions. Make sure that you're going to keep your valve. It's a living part of your body. There's no artificial device we can put inside the heart that can beat your own living tissue, and I think it's so important to get opinions and be really confident in your team before you undergo a procedure like that.